Given the crisis that our province is facing and the state of public health emergency that was issued yesterday, I will keep Albertans informed and will be here regularly to answer questions to the best of my ability. I also want to pause here to stress one point from yesterday's announcement regarding the restriction exemption program. If you were seeking a negative COVID test result to access a business or service, you must get this test privately. Alberta Health Services testing is for those with symptoms, those in outbreaks, and those who need it the most. These tests will not be applicable to the exemption program. Of course, instead of paying to get a negative COVID test done privately, you can get vaccinated for free. This will provide real protection, help beat down the wave, and save you the money spent on testing. Turning to today's update. Over the last 24 hours, we have identified 1,718 new cases of COVID-19 and completed about 16,300 tests. Our positivity rate was about 10.6%. Our hospitalizations continue to rise, and there are 896 people being treated for COVID-19 in hospital, including 222 in the ICU. There are now 18,706 active cases in the province. Sadly, I must announce that 10 new deaths were reported to Alberta Health in the last 24 hours. Every life lost leaves behind grieving family and friends, and I offer my sympathies to those who are mourning these losses and losses from any other cause. These deaths and all that have preceded them are further reminders that there are many vulnerable people in our province. As I said yesterday, our actions have never mattered more. We have a collective shared responsibility to keep everyone safe. This is the glue that holds our society together. Today, I want to help clarify some questions that we've heard about the restrictions announced yesterday. I know it was a lot of information at once, and I want everyone to fully understand the rules going forward. Many Albertans are asking why social gatherings need to be limited if everyone attending has been vaccinated. It's a fair question, especially when immunized Albertans have done the right thing and have gotten protected to try to keep others safe as well. The answer is that our healthcare system is straining to treat the number of COVID-19 cases we currently have in Alberta. While close to 78% of the cases currently in hospital, including ICUs, are unvaccinated or only partially vaccinated, that still leaves 22% of those in hospital who are fully vaccinated. Many of these individuals have underlying health conditions that have affected their immune systems and their ability to fight off infections. In addition, while 2 doses of vaccine are generally about 85% effective at protecting against the Delta variant, that still leaves a 15% window for infection. And since the presence of COVID-19 is so high in our province right now, we need to do all we can to safeguard ourselves and our healthcare system and to stop providing all those opportunities for COVID-19 to slip in and spread. We've also heard questions about whether weddings have to follow the 50-person limit if they implement mandatory vaccination. The answer is first that this restriction comes into force on Monday, so events this weekend can continue, although I urge everyone to take every possible precaution in all events. Secondly, venues that host these types of events are able to choose to implement a restriction exemption program with proof of immunization or a recent negative, privately paid COVID-19 test. If a hosting venue has implemented this program, then the wedding or funeral taking place in that location is able to proceed without the cap on numbers, as long as all attendees over the age of 12 have valid proof of immunization or a recent negative, privately paid COVID test. Again, a reminder that AHS COVID tests cannot be used for this purpose. Only privately paid COVID tests are an option for admission purposes under the exemption program. Related to that, I have heard some confusion about which businesses count as essential for daily living and so are not able to put in place an exemption program. We're working to put together a list of sectors on the website, but this would include examples such as grocery stores, gas stations, and retail such as hardware stores. Other questions we've heard have been around personal services such as hair salons. These are subject to the mandatory masking rule and a requirement that physical distancing be maintained at all times except for while the service is being provided. Finally, we have also heard questions about whether businesses need to apply for the restriction exemption program to be eligible. The answer is no. Businesses simply need to consult the material we will be posting tomorrow on our website and implement the process described there in order to qualify. However, audits and enforcement will occur to make sure the rules are being followed. Starting Monday, any location that is not following the restrictions but has not properly implemented a vaccine verification system would be violating the public health orders in place. All of the public health orders are mandatory and legally enforceable. Any police agency or public health inspector is empowered to take enforcement action as they see fit. However, enforcement is always a last resort. As I said yesterday, hard as it may seem, we need to work together to beat back this current wave. I know the new measures come as a disappointment to many who have worked diligently to keep our province safe. I know that many are frustrated and tired, and both of these are understandable. However, despite this tiredness and frustration, the virus is not going to stop without us. We are all currently playing a role in preventing the spread of the virus, protecting ourselves and protecting our community. By following these rules in not just the letter, but the spirit of them, and avoiding contact as much as possible with those outside our household, we can get back on track and bring our cases and most importantly, our severe outcomes down. This is the key to reducing pressure on the healthcare system and saving lives.
Pressure on our healthcare system continues to be severe. We continue to add capacity wherever and whenever we can, and we can also see more and more patients are actually being admitted to the critical care units. We currently have 310 beds open in Alberta, including 137 additional what we call surge spaces. AHS has opened 43 additional ICU surge spaces in the past 7 days. There are currently 268 patients in the ICU, 75% who are afflicted with the COVID virus disease. Provincially, ICU capacity, including additional surge beds, is at 86%. But remember, without these additional surge beds, provincial ICU capacity would be in excess of 155%. The number of patients in ICUs increased by 16% in the past week. This fourth wave has resulted in the sharpest increase in ICU patients that we have seen throughout the pandemic. And I continue to be amazed by our incredible physicians and staff who work tirelessly in providing care and creating capacity. Because of your dedication and efforts, Albertans are able to get the care that they need. I've said before that healthcare is a finite resource. We do not have the ability to simply open more and more ICU spaces and hospital beds, and we do not have an endless number of staff who can provide critical care. I'm aware that one of our internal planning documents was shared publicly this afternoon, which suggests that we are days away from having our ICUs overwhelmed. There is no question that our ICUs are under extreme pressure. We continually are finding ways to increase our capacity, and our numbers change daily, if not hourly, and the teams are working 24/7 to ensure that we don't reach that point. Our goal right now is to open as many critical care spaces as we can, safely staffed, and create as much space that we need, anticipating the numbers that are coming ahead. Let me be clear though, these are not standard ICU beds. Care will be and is already different as we move to different staffing models and different spaces. This is extremely challenging. We continually do all that we can in the face of this ever-changing pandemic. AHS has moved to its highest level in terms of its surge response. This step is designed to add additional capacity using a number of different tools, and I'd like to briefly talk about those now. We have asked our teams to identify and open any spaces that can be used as an ICU bed. This includes spaces such as operating rooms, post-anesthesia care units, observation spaces, and recovery wards. This means that patients needing critical care may receive it in a space that is not usually used for ICU. We are taking measures to ensure this is safe, given the extraordinary circumstances. Our pandemic response units in Calgary and Edmonton remain in a state of readiness, and we will open them if the situation requires that level of care. We continue to discharge patients home or to a continuing care setting as soon as they are ready to be moved. This may mean that patients are transferred to a facility that is outside their home community or their zone. And we're having to postpone further surgeries. This is a tremendously difficult decision, and again, I'm deeply sorry to all those who are affected. Any surgery that must be completed within a 3-day window will continue, and all non-urgent scheduled surgeries will be postponed. As I mentioned yesterday, we have reached out to other provinces to see if they have any available space where Albertans could get the care that they need. And we are asking them if they have skilled frontline staff who may be willing to come to Alberta to assist us. Ontario has graciously offered their help, and we are in discussions with them regarding potential transfer of patients if needed. We remain hopeful that it will not come to those terms as our teams continue to add critical care capacity in Alberta. I cannot stress enough how serious the situation is in our hospitals. I promise you that we will continue to do all that we can to provide the care to Albertans. I also cannot stress enough that we need your help. Please get immunized. If you have any fears, concerns, or hesitations, please reach out to a healthcare professional, call 811, or visit the AHS website. The vaccine is safe and effective.